morning, good afternoon, good evening. This is Oakland Is. And today I'm so excited to have our guest from CW Analytical. I have Robert Martin, PhD, and I have John Oram, from a PhD from the same CW Analytical, and they're going to answer a lot of our questions that we have about medical marijuana. And I have some questions here that I'm sure you guys are all ready to go for. The first one is, tell me a little bit about CW Analytical.
Go ahead. Well, we were a company that was founded in 2009. We came about because we were patients first, and as patients we saw a need in the industry, and we come from a background of science, obviously, and we thought we could add our science to the fray, so to speak, and help the evolution of the industry along, especially with quality assurance procedures, and that's what we're really focused on here today.
Well, that's a good thing, a really good thing, quality assurance, because a lot of patients are using medical marijuana, and we want to be sure that it is good medicine, right? Okay, so what are the services that you do?
We test all sorts of medical cannabis products for potency. We want patients and the stakeholders in the community to understand the potency of the medicine that they're purchasing at local collectives. We also test for safety and quality measures such as yeast and mold and bacteria, and also pesticides. We want to make sure that the medicines that you're purchasing are of a known potency and that are free of contamination.
What are some of the reasons for potency to be so important? Can you break that down for me?
Sure.
Why is it important?
Sure. Robert has some.
Potency is really a quality attribute, we think. Initially, a lot of people believe potency measurements are taken for people to understand how strong their medication is or how strong the pot is that they're smoking that day. However, the quality attributes of potency relate around dosage requirements. If we understand the potency of a certain material, then we can formulate properly the dosage into specific edibles, or a patient can understand the potency of a medicine they're taking that day in relationship to the pain they're trying to alleviate. And for instance, they might take half the dosage the next time, double the dosage the next time, if they know what the potency is when they're taking it. Prior to this information, it was always hit or miss. I mean, we really had no understanding of potency other than the euphoric state that it put us in, or the pain relief it gave us.
I see. That's good stuff. Who are your customers?
We work with basically the entire medical cannabis community, and that ranges from cultivators and edible producers, collectives, so dispensaries and collectives, and of course patients. We work with the producers and the collectives so that they know that the medicines that they are distributing to patients is of a known quality and it is safe. We also work with doctors who are interested in medical cannabis but maybe are uncomfortable recommending it to their patients. We want to be able to give the information that many of these medical doctors need in order to become comfortable with this natural medicine. And we work quite a bit with local governments and local and state governments so that they can also understand what's going on in the cannabis community and let them understand that we are implementing quality controls at a very organic level.
Oh, that's great. So you've told me that you test everything, the clones. Can you break down what a clone is for me?
Yes, yeah. A clone is a way that cultivators can propagate plants from, rather than using seeds, they're able to take cuttings, little clippings off of a female plant, and they're able to propagate those plants into smaller, or rather into their individual pots, and those little clippings can get roots and become large plants on their own. So it's just a propagation method that cultivators use in order to, well, it helps them to spread out and grow a consistent plant, from day to day. And we can help them. We don't test many clones, but we can help them to understand if sometimes clones can get a bacterial infection, and if they need to know that, because they wouldn't want to propagate that same clone, month over month if it's going to be infected in some way. So we give them some insight into those processes.
So it's the flowers, the plants, the edibles.
Of products that we test?
Yes,
that's right.
that you
Yes,
test.
we mostly test finished products, which are dried flowers and different concentrates such as hashes or oils or butters, some lotions and salves and soaps and things, that various products that people are bringing to market. And then we focus quite a bit on edible products. So, cookies and brownies and chocolates, and that's sort of the old guard of edibles, and now edibles have come a lot further. There's, you name it, there's pasta sauces, there's all sorts of different products that are coming to market these days.
Jalapeno crackers.
Yeah, crackers.
Oh, yeah, all
Sure.
kinds of
I saw
different-
popcorn, caramel
Sure, caramel
Popcorn.
popcorn, yeah.
Wow, it's
Yeah.
amazing. It's wonderful if you're into edibles.
Yeah.
So what is a common type of some of the contaminations that you can, see while you're out testing? What are some of those contaminations that?
Well, one of the things that's been most surprising to us is the amount of bacterial contaminations we find in some of the flowers. When I first got into this, I believed that the terpenes and the natural occurring compounds on the outside of the plant were antibacterial. And so I considered, we had several conversations about microbiological testing of the flowers and whether it would be important or not. And so we decided to go ahead and do due diligence and begin testing. And we were very surprised to find that some of the material coming in was very, very contaminated, showing very high numbers of bacterial population on the material. And with further investigation, we found out that there were hygiene issues involved, that people treating and curing the cannabis weren't handling it properly, or they weren't cleaning the screens they were constantly putting it over time, or they weren't changing their gloves appropriately, or there was some hygiene issue involved. And the nice part about this industry is everyone cares. We haven't met a client yet that has taken that information in a bad way. They've taken, information that we found contamination to heart, and they go back and make corrective measures right away. And to me, that's a great signal. It's a great signal. There's a lot of heart in the industry, and people really care about what they're doing.
Yeah, that's a great thing.
Yeah.
Advocacy is like major. It's like you've got to have that wanting to know, needing to know, and to tell and share with others. Because we would not want to think that we're eating stuff that's contaminated, or it's mold and yeast and pesticides, herbicides. We want it to be organic, so it's a good thing.
We find that the companies that sustain in this industry are the ones that do have a certain portion of advocacy within their business plan.
Oh, great.
We're information providers, and we work with a whole range of clients throughout the community, throughout the cannabis community, and even outside of the cannabis community. And we're looking to, and we do this day to day. We gather information, we gather the raw data, and provide the information that really empowers every stakeholder within the community to make informed decisions. We want patients to be able to make informed decisions, so when they're buying their medicines, they know what type of medicines that they're looking for, what sort of potencies they're looking for. We empower dispensary operators to make better choices when they're purchasing their medicines. We empower doctors to understand the effects and the potency and the safety and quality of the medicines that are on the shelves. And we empower legislators to really understand what we're doing as a community, and how can they how can they regulate us? And what is the need? How much do they need to regulate us? I mean, we are a very good community. We're all upstanding people, and I think I think the legislators and I think that the public in general is starting to see that the cannabis community, we're positive people. We're not criminals. We're here to do the right thing, and so that's something. That's sort of the advocacy piece of what we do. We provide the information and we help advocate that positive message.
I'd like to add that Oakland's a great town to do this in.
Yeah.
Oakland's been very supportive of us. They've been encouraging to us. We've met with the city fathers over and over again through the months. And I couldn't think of a better city to do what we're doing in than Oakland, California.
Well, there's a university right on Broadway, huh?
Oaksterdam.
Oaksterdam University? Come on.
Well, it's a school to provide education, like John says, to the medical marijuana industry. And it's providing a very, very worthwhile function there in Oakland. But Oakland's a great town for it. I can't say it enough. I think if you're going to get into the medical marijuana industry, the center of all of it is here in the Bay Area. For the whole world, the center is here.
Wow.
That's how we believe it anyway.
Yeah.
And everything will then evolve from California onto the other parts of the country and all that sort of thing. But CW Analytical is focused only in California.
Okay.
We do not look beyond the state, for anything at all other than focus here in California.
Okay.
That's where our needs are.
Yes, yes, yes. There was a website that I went to. It was called American for Safe Access, and it was very interesting. Are you aware of it?
Absolutely.
Yeah.
We work with them.
Oh, okay.
Yeah, John can tell
Yeah,
you
that's
more about
the organization is ASA, Americans for Safe Access, and they're an advocacy and education and public outreach organization. They really, they're helping to promote sensible regulations, sensible legislation around cannabis on a local level, on a state level, and on a national level.
Oh.
Very, very good organization, and we do work with them.
Good, good, good. I'm glad to hear that. Yeah. Robert.
Yes.
I understand you have a lot of experience with the food industry.
Right. I spent 25 years in corporate food in the United States and actually internationally, if you will, with large corporate food concerns. And through that experience, I learned to do new products. I learned quality assurance. I learned laboratory function, laboratory procedures. From the food industry point of view. So a lot of what CW Analytical does today is based upon those early or the preliminary results of the food industry. For our edibles, for instance, we use the same standards that that grocery stores use for providing food to people today. So if you pass our standards, we consider them food safe. We're always trying to refine and make our standards more rigorous. And a lot of people argue, since we are an alternative medicine, that we need to have more rigorous control. And John and I are always on that scent, trying to make it more rigorous, trying to make our quality procedures redundant, quality repeatable, and more accurate every day.
Good stuff.
Yeah, and to that effect, there's a few other cannabis laboratories in the region, and there's quite a few across the state, and a few of the local laboratories here in the Bay Area have joined together, and we've formed an organization called the Association of California Cannabis Laboratories, and together we've managed to we have 10 or 15 member laboratories across the state, and we've created a forum to do exactly what Robert is saying. To sit down, the laboratory operators can sit down together, talk about what we see in the industry, what we see in the marketplace, how are we operating our laboratories, what sort of scientific protocols and standards are we developing, and we really believe together that that's the way forward, is open science, strong science, and a community of community approach.
I don't see why everything's going to be just great with the marijuana stuff, the medical marijuana, because I think you guys got something here. You
Thank
guys you guys are making it more accessible, safe access, safety for using, you know, so it's like the FDA with stuff, you know, somebody's got to go through something. But when it wasn't being monitored, I think that was not a good thing. With all the things you guys have found already, I mean, come on, mold, yeast, contaminants, pesticides, come on, it's like, that shouldn't be in my brownie.
That's right, and people that are sick don't need those kind of things.
No.
A lot of this stuff goes through your liver. I mean, if you eat it and ingest it, it goes through your liver and can really lodge in your liver and cause awful contraindications later on. We don't want to do that.
No.
And if I might add to what John was saying, early on we went out to a lot of different regulations and regulators around the state, and we talked to a lot of city fathers about what we're doing, how we could push this on, maybe get support from city fathers and regulatory agencies. And they were all pretty, you know, hot potato with us. You know, they were concerned that, oh, if we get involved with this, we could bring on federal scrutinies, and there were a lot of pushback on us. And we were told to go do it ourselves. So we are.
So you
know,
are.
we are. We're doing it ourselves, like John said. We've called the other laboratories in, and we've got a lot of good science acumen in the state of California now looking at this. And we're doing it ourselves until we can find a regulatory agency that's willing to work with us. We will stand ready.
Well,
So,
I guess
that's
the
my
fight.
advocacy for
Oh,
that.
okay. Now, who is the fathers that you speak of? What's that term?
Well, I use
The
city fathers,
city fathers.
in a very loose fashion. City fathers are the city council members, mayors, the city managers that we talk to throughout the state.
Okay.
And we've made some great friends. I've personally made some great friends with police chiefs around the state, and they've been very helpful in me understanding their point of view. And prior to that, I didn't understand their point of view, and hopefully now they understand some of mine.
Yeah, that's a good thing to have
Yeah.
you know, both everybody's understanding and communicating and all of that. I think that you guys are really bringing something to the table. It's nice to have met you and have you come to educate us on what we need to know, because if people are going to be using it, they need to have the best, just like everything else, you know. They need it to be good and clear and all of that.
You know, I want to address one thing. You asked about, you know, what sort of contaminants we see. And, you know, we mentioned we have seen some bacterial growth. We've seen some pesticides on products. But I'll say that in general, it's less than 10% of less than 5% of the products that come across the samples that come through our lab really exhibit any kind of, you know, harmful or dangerous contamination. And I think that speaks to you know, the community as a whole. The growers and the edible producers that are out there, they are interested in doing the right thing, and they've been trying to do the right thing. And we're not here to tell anybody that they're doing the wrong thing. We're here to help you do it better. We want information is what we want to provide, the information to help everybody do their job better. And, you know, maybe it's sort of self-selecting in some sense. You know, it's going to be the cream of the crop, I think, that are going to use laboratories. You know, it's the people who are already concerned about their own quality and their own safety of their products. So maybe we're self-selecting for that. But I do want to say it's an amazing community and very thoughtful and very, you know, very just wonderful individuals and companies that we're working with.
That's awesome.
And we've been having a lot of success around the state, showing another face to the industry. You know, many people think when you're dealing with the marijuana industry, you're dealing with a bunch of stoners. And they're going to come in, they're going to talk to you in terms that you can't understand, they're going to look differently, and they're going to be kooky and all these things. We show up with suit and tie, and we show up with professionalism and scientific acumen, trying to bring legitimacy and credibility to an industry that's emerging right in front of everyone. And it's pretty exciting if we all think about it.
Yes.
And it still takes a lot of courage from a lot of us to move forward through the everyday trials and tribulations we have. But we have faith in this country we live in, and we truly have faith in Oakland. You know, Oakland's been really, really wonderful to us, and I can't say it enough.
All right.
They're extremely supportive of what we're doing.
Yeah.
And I wouldn't want to have a laboratory anywhere else in this great country.
Wow.
That's right.
Well, that definitely gives us a thumbs up here. So you guys are in the right place. We're all in the right place right now. You know, the playing field is changing. I can remember stories about plants, but none that I'll share right now. But at any rate, I think it's a wonderful plant. I love plants. You know, I'm a gardener. I love edible plants. I love it. I had a few passion flowers on the way in, you know, and I just, you know, so maybe the contaminants are there. I don't know, but
well, you know, and we're just learning about this plant. You know, I mean, it's the legal issues around the plant have really hindered any sort of scientific advances in the United States. You know, it's just been in the last few years that, and within California in particular, where we've been able to do these sorts of studies and be able to really put really to understand this plant. You know, there's over 100 different active ingredients in the plant itself. We only concentrate on one or two of them. But what about the rest of them? And what about the effects, the synergy between the minor compounds and the major compounds? These are just things that are, you know, right here in front of us. You know, there is an FDA-approved synthetic THC called Medicinal. It's just one. It's a synthetic of just one of the active ingredients, and those who use it complain that it doesn't give them the relief that the natural product, the natural cannabis, does. So, you know, it's the synergy between all these wonderful compounds, and without the science that we are doing and that other laboratories in the state are doing, we wouldn't be able to understand those, and we wouldn't be able to move towards, you know, a more, I guess a more regulated, a more medical, a more titrated use of this medicine. Yeah.
Well, I tell you guys, I mean, I'm feeling pretty safe right now. You know, it's like, but it's just fascinating. It really is, because there's so many herbs out there, and you know, I've been learning plant ID with herbs for a while now. I'm an alternative medicine woman myself, but the marijuana just kind of, the cannabis just kind of went a different place than the others. You know, it's like, that's always interesting to me too, you know, because there's a lot of herbs that you can eat, you can feel certain kinds of ways, the calm, you know, the Prozac feel from Passiflora, you know, the vitamin D that's in the nasturtium, and you know, all these kinds of things. But then the marijuana just kind of went a whole nother place, because it was like it started someplace else.
Well, we put it there, you know, the laws and
In the 1930s, vilified it, and a lot of people have said if it was just discovered today, it would be taunted as the greatest panacea ever discovered in humankind. But since it's been vilified by the 1930s and it's become this, I don't know what to say about it. I really wouldn't want to get into that today too much, but just the total number of ailments that it treats is enough to give one repose, and you should step back and look at it. Now new studies have showed CB2 receptors, which are found in our brain to be able to use cannabis, are also found in lower animals. So that's an interesting evolutionary thing that we just found. If lower animals have the same receptors in their brain for cannabis, why would they have them there? It's an interesting thought if you think about it. But I just learned that recently as another provocative nature of this compound or this plant that we look at. So it's a very interesting thing we're doing.
It is, and exciting. I can feel the excitement, because it's like brand new stuff, you know, research and study and all of that. The breakthrough is phenomenal, and to have it be medical marijuana is like absolutely the best. Listen, I am so happy about all the information I've learned today, and that our viewers are going to learn today, because this is going to be the beginning for them to just kind of see that the scientific study now, and you know how it's changing, the safety to you know, taking the criminal element out of it, you know, all of that, all of those things that make it so wonderful for what's happening here, and I'm glad to be a part of it, and I'm glad you guys are out there working for us, hard for us.
Love to have you come by the lab sometime.
Yeah, that's going to be a follow-up show. We're
Excellent.
going to come, follow up, come and see what you guys are doing out there.
Excellent.
Yeah,
Excellent.
thanks for inviting us. So until next time.